Good afternoon, everyone. And before we start, I would like to read the land acknowledgement statement that we respectfully acknowledge that the University of Arizona is on the land and territories of indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and indigenous communities through education offering, partnership, and community service. With that, it is my pleasure to introduce to you the Ending Pandemic team. So Ending Pandemics has spent over a decade providing technical assistance and catalytic funding to accelerate the ability to find, verify, and contain outbreak faster in over 50 countries across the globe. We are excited to be joined today by 3 members of the Ending Pandemics teams. First, you will hear from Dr. Mark Smolinski, President and founder of Ending Pandemics. Also is my classmate, graduated here from the U of A, first class of public health graduate. So Mark, along with myself, was a member of the first graduating class of the College of Public Health. Since that time, Mark has been a strong supporter for the University of Arizona and was recognized as the College Alumni of the Year in 2016. Thank you for being here, Mark. Mark is joined by Nomita Divi, who is the Executive Director of Ending Pandemics. Nomita has over 20 years of global health experience in strategic planning, program design, and stakeholder management in both the academic and the philanthropic sectors. Happy to have you, Nomita. And the final member of the Ending Pandemic team has recently joined the College of Public Health as a research faculty. Onicio Leal Neto brings 12 years of experience in digital epidemiologies and technologies applied to disease surveillance, and I am excited to have him now on my team, so welcome, Onicio. So with that, I would like to invite you all for the presentation.
Good afternoon, everybody. The Ending Pandemics in Our Lifetime initiative was a 10-year plan to help find, verify, and contain outbreaks faster in some of the most remote, hottest disease spots around the planet for the emergence of new infectious diseases. Our work has been supported by Jeff Skoll, who's a visionary filmmaker, humanitarian, and philanthropist, and we applied over $50 million over the last 10 years with the freedom to be bold and to challenge traditional thinking. The results are some of the most innovative approaches to disease surveillance and will help bring an end to pandemics. An end that is truly possible if we all work together towards a common goal. So today we want to share with you 3 novel approaches that are now public goods available to the global health community as free digital tools. As you pursue a common goal in One Health, we hope you will find these tools very helpful. The third of the tools you're going to hear about this afternoon was moved to the Global Health Institute here at MSPH in 2023 as its permanent new home. Before we dive into these 3 innovations, let's make sure we're all on the same page by what we at Ending Pandemics mean by disease surveillance in One Health. So let's start with the simplest yet most useful tool by field epidemiologists, modelers, and policymakers for looking at the dynamics of an infectious disease epidemic, which of course is the epicurve. So when we look at the epicurve, we know that the area of the curve represents the impact of any pandemic. So systemized, routine, notifiable disease reporting has certainly helped us find outbreaks faster and thereby reducing the overall impact of an epidemic by reducing the area under the curve. The ever-vigilant physician or clinician calling attention that something is just not quite right can sound an early alarm for an epidemic or a pandemic. That was the case here in Arizona in 1993 when hantavirus was first discovered in the Four-Quarter region. And that happened because clinicians were discussing cases in the doctor's lounge where they had seen several cases of 20 to 30-year-olds who succumbed to death from a flu-like illness within 24 to 48 hours. So the idea of reporting something unusual has still been one of our greatest assets in finding outbreaks faster. We also benefit globally by sentinel networks like those for influenza, HIV, TB, and malaria. Probably one of the biggest advances in helping us find outbreaks faster has been our ability to monitor electronic media and other digital sources of information, and we often refer to this as digital disease detection. When I was at Google, I worked with a team of engineers to develop Google Flu Trends, which helped us identify flu up to 2 weeks earlier in all parts of the United States. And we now know that this approach is spreading to other media platforms, including social media like Facebook, Twitter, and WhatsApp. But perhaps most important for us at any pandemics has been our investment in even earlier detection by engaging communities directly to be part of the solution. And many of these early detection efforts focused on detecting outbreaks, mainly in human health. But for us, true disease surveillance in One Health means we have to think beyond just the humans. And since we know that almost all infectious diseases, and certainly most of the emerging infections, spread from animals to humans, so we must really look at disease surveillance that encompasses both of these, including thinking about the physical and social environment and all of these other factors that contribute to disease surveillance. So while this might seem like an impossible challenge to do One Health disease surveillance, at any pandemics, we believe participatory surveillance, defined as the bidirectional process of transmitting and receiving data for action, is one of the most cost-effective, efficient, and inclusive methods of One Health disease surveillance. And I want to show a short video.
Outbreaks happen every day around the world. The challenge is preventing any one of them from becoming the next pandemic. Speed matters to stop a spark from becoming a raging fire. We need eyes and ears everywhere to quickly identify and report unusual events in humans, animals, and the environment. This approach is called participatory surveillance. Communities are actively stepping up to become part of the solution. In Cambodia, people are reporting health events in real time through a free national hotline. In Thailand and Tanzania, local health workers are finding outbreaks in animals before any spread to humans. And in Brazil, this approach was used for the first time during mass gatherings. Everyone has a role to play in stopping a threat anywhere from becoming a threat everywhere. Expanding participatory surveillance across the globe will keep us all safe from the next yet unknown threat. Help us empower all communities to stop pandemics before they start.
So after 2 years of scouring the literature, sending out surveys, and contacting every system we could find across the globe, we want to introduce to you today the One Health Participatory Surveillance Map. And so this map represents all the current systems across the One Health spectrum that are directly monitoring the health of humans, animals, or the environment. And that this map includes one of the first vector-borne disease surveillance systems developed here at the University of Arizona by Casey Ernst. And we're happy to have that one on the map as well. So on this map, you can click on any of these different colored icons, and we'll pick one here that shows all three sectors. And when you pull that up, you can click for more information, and a data card will pop up on the left that has the same information for every system across the globe, including how to contact the organization who created the system directly. We have filters here at the bottom where you can choose the different sectors, any combination of those to see the systems on the map. Or if you happen to know the name of a program like Kadenga, you can search for that directly, or the country directly. And again, any of these dots have the same information on a data card on the left so you can contact the system directly or learn more details about it. And then here on the far left, we have a guide so you can go through and look at it yourself, as well as if there's a system that we don't have on the map, you can submit that system to us directly, and we'll do the due diligence and add that. So we hope that you will find this resource helpful as we continue to keep it updated as new systems are identified and developed in the years ahead. So moving on to our second tool to share with you today, for those of you who might be wondering astutely as you see all these early detection tools, how do we monitor them for accuracy or prevent false alarms from developing and spreading? So this important step of verification was very important to us, and this is even more of a challenge as One Health looks at human, animal, and environmental data. So now I'm going to turn the presentation over to Nomita Divi, our Executive Director, and she's going to share more on this second tool.
Thank you, Mark. I'm excited to be here with you today to talk to you about a unique system called EpiCore. So what is EpiCore? EpiCore is a network of human, animal, and environmental health professionals who are crowdsourced to provide ground truths for verification of indications of a health event. EpiCore was created with the goal of reducing the time it takes to verify indications of an outbreak. So I'll play a short video that introduces the concept.
Unnecessary delays in the effective response to a genuine health threat are often the result of the time to verification. This is the time it takes to determine if a reported threat is real, so that an appropriate response can ensue. What if we could connect a global network of human, animal, and environmental health professionals to help verify early signs of potential health events? We can. This is EpiCore. EpiCore is a volunteer virtual community of One Health professionals crowdsourced to support rapid verification of potential health threats. Created in 2012 by Ending Pandemics as an initial partnership among TefiNet, ProMed, and HealthMap, and officially launched in 2016. EpiCore volunteers have been quickly verifying early warning signals or refuting rumors of potential outbreaks, thereby preventing delays in rapidly responding to true health threats. This is how EpiCore works. The verification process consists of confirming or refuting early signals about potential events through the contribution of cross-sectoral health professionals in the same geography where events are reported. All verified information on EpiCore is shared openly online. Currently, requests to the network on average receive a response within 24 hours. Among its many utilities, EpiCore has been used for verifying early detection signals, risk assessment, and monitoring ongoing health events. EpiCore does not aim to replace any official verification system and is meant to be a complementary verification tool supporting health authorities and is currently contributing information to WHO's EIOS platform. EpiCore provides a novel mechanism to increase the speed of verification of early warning signals detected across the globe.
So since its launch in 2016, EpiCore has been verifying indications of human, animal, and environmental health events, improving signal specificity, and contributing to epidemic intelligence. I'm happy to share that we just published this month an article in the Journal of Medical Internet Research that highlights case studies on the system and showcases EpiCore as a practical and creative example of participatory One Health epidemic intelligence. To further elaborate the utility of EpiCore, I'd like to share with you a case study on COVID-19. As already mentioned, and as you know now, EpiCore provides a secure platform on which queries about public health events can be requested of our expert network. So in late December of 2019, when a cluster of severe acute respiratory illness cases were happening in Wuhan, China, the Ministry of Health in Hong Kong, put out an alert on December 31st. Seeing this alert, on January 1st, a request for information was issued to our network on Epicor about the situation. Within minutes, we received a response that this event was not only happening at a seafood market, as the press was stating, but the market also sold other animals. This was helping us understand that there was a potentiality of a zoonotic disease. On January 2nd, members shared that they were being reprimanded for misinformation in the spreading of that, and that the exact pathogen was yet unknown. They also shared later that day that they suspected a coronavirus crossing the species barrier. Information continued to trickle in, and WHO put out a statement on January 9th. And on January 10th, Epicor members reported when the first case was detected in a different city in the same province, indicating the spread of these cases. The information was summarized and placed on Epicor's public dashboard for the public to see. We feel like we're really just at the tip of the iceberg when we're trying to recognize the potentiality of such a platform, and we're actively exploring other use cases for this system. For example, Epicor has been contributing to training and capacity building across the globe, because Epicor requires that every member has to complete a short training on epidemic intelligence and a training on how to use the platform before they can have access to the system. Furthermore, we believe Epicor is well suited for student learning and research projects, and I will highlight 3 examples. It can be used to teach students how to assimilate information for risk assessment. It provides independent research opportunities on what it takes to recruit and retain members. And individuals interested in measurement can analyze the data and assess outbreak verification timeliness trends. So we hope you will check out Epicor at epicor.org to learn more. And so with that, I would like to turn it over to Onicio Leal Neto, who is a longstanding member of the Ending Pandemics team. Onicio has recently joined MESCOF as research faculty here, and he will share with you the 3rd tool that we're going to highlight today that now resides here at U of A.
Thank you, Nomita. Good afternoon, everyone. I hope you are finding the insights shared by Nomita and Mark as enlightening as I have. Their dedication to advancing our understanding of global health is truly inspiring. Now, I would like to capture your attention for the next few minutes to introduce an initiative that Mark hinted at earlier, an initiative that's close to our hearts, Global Fluvio. What's Global Fluvio, you ask? It's a digital ecosystem designed to map the activity of influenza-like illnesses across the world in real time. Our goal is to make this information as accessible and as understandable as possible to everyone. And how do we achieve this? By serving as a central hub that orchestrates the flow of data from numerous flu participatory surveillance programs, spanning 4 continents. And this involves connecting with our program partners through APIs or other means to ingest their data, standardizing this data to ensure uniformity and comparability, visualizing the information through a user-friendly interface on our website, open to anyone interested in exploring the data, engaging with academic and public sector to maximize the impact of participatory surveillance in comprehending the spread and impact of flu. As of now, our platform integrates data from a diverse array of countries and programs, making Global Fluvio a comprehensive resource of flu data. We are covering North America through Outbreaks Near Me. We are covering 5 countries in Europe through InfluenzaNet and Surprise Plus. We are also in Asia, in Thailand, through Sixth Sense, and also in Hong Kong with Flu Tracking Hong Kong, and also in Oceania with Flu Tracking Australia. Global Flu View is well suited for academic environment for a variety of users and uses. Students can immerse themselves in the exciting field of participatory surveillance using Global Flu View as a sandbox to develop projects, improve their data visualization skills, and enhance their coding prowess. Researchers are empowered to leverage our data to train machine learning models, create synthetic data sets, and foster a collaborative environment for sharing methodologies. Public health institutions gain the ability to monitor flu activity from a global perspective, initiate hyperlocal surveillance programs, and integrate these insights with existing disease surveillance frameworks. And to give you a taste of what we've accomplished, I would like to share a sneak peek of our website, which has been live and evolving for 1 year now. When visiting globalfluview.org, you will encounter a wealth of information detailing our ecosystem, program partners, and additional resources. Upon navigating to the Reports tab, you will find a dynamic time series chart that consolidates data from all programs over time. Various filters are available for symptoms or specific programs, enhancing your ability to explore the data effectively. The Map tab allows you to zoom into covered regions, revealing aggregated reports and clusters of influenza-like illness. You can toggle to a heat map view to visualize the concentration of flu reports. You can zoom in to specific regions and see how much we are covering already in several different territories. When you go to the Resource tab, it houses an extensive library of materials to acquaint you with participatory surveillance and provide scientific evidence in this field. So in that part, you'll find several instructional videos and different articles showing that participatory surveillance is actually a very powerful tool for public health interventions. Additionally, our Code Lab feature serves as a collaborative environment for researchers and students to share code, methods, and techniques. So it's a very real place to do knowledge sharing with methods that you developed and can have other people collaborating with. In closing, Global Flu View is more than just a platform. It's an ecosystem to what we can achieve when we come together to share knowledge and resources. We are excited about the future and the role each of you can play in it. Thanks for your time, and I'm going to hand over to Mark Smolinski. Thank you.
Thank you, Onicio, and thank you, Nomita, and thank you all for your attention as we wanted to share these 3 tools with you today, knowing that you are all One Health enthusiasts, as we are as well. And we hope that these tools will provide you endless opportunities to explore rich data sources, utilize these tools to help you with your research or independent study, and that more on everything you heard about today can be found at our website at endingpandemics.org.